Good morning, fellows. We are talking about insurance plans. US insurance plans for beginners, students, and elders, and jovians and businessmen. In the coming weeks, the majority of Americans will engage in a bizarre, madly terrifying, distinctly American seasonable ritual. I refer, of course, to open enrollment, the time when you sign up for your health insurance plan. If you are covered by your employer, it's time for confused emails and phone calls to your human resource department. If you sign up for your own coverage, it's time to puzzle through the benefits you can get through the Affordable Care Act of Medicine and Medicare. It might also be a time when you ask yourself why it has to be this way. Look around the world as Vox did a few years ago, and it's clear there are much simpler ways to run a healthcare system. Some rich countries have all public insurance, some private coverage, but they have a few things in common. They insure pretty much every day, and their system costs less money. And whatever you have, healthcare has nothing to do with whether you are employed. Open enrollment, if it exists at all, it's much simpler exercise. In the United States, however, 57% of Americans under 65 get insurance through their jobs. Attempt to reform data system have all failed. And why Vox is covering open enrollment? Open question is why your job controls your health care. The modern American health systems began to take shape in the late 19th and early 20th century. Clinical practice improved, medical schools and state licensing board began credentialing doctor, and the number of hospitals grew. All this meant the cost of healthcare started to rise. Patients were more likely to receive critical care, but also face untenable bills for that care. By 1929, US families were spending on average 5% of their income on medical expenses. So during the 1920 and 30s, some employers began offering a new benefits, health insurance for hospital-based medical service. Insuring people through their work offered two advantages that were obvious to employer, hospital, and policymaker, and Polestar, who wrote the seminal history. The social transformation of American medicine told me. These plans pulled together larger group of people, some healthy and other not. Health insurance would only work with a delicate mix. Almost from the beginning, political vintage, the severing the links between employment and healthcare during the Great Depression. FDR considered making national health insurance part of his signature New Deal legislations, which would have made the US a pioneer. But those previous were next to prioritize the Social Security, retirement, and disability programs, among other. Then in World War II, companies grip on employee health care and got firm. The federal government established wage control, limiting how much employer could pay worker. It's not ideal, but it's just a functional enough. It is a real barrier to doing anything big. John Allen at the Urban Institute who helped to create proposal respectively. Now my video has been complete. Thank you so much.